Here continuation to previous video. Here generalized plasma concentration time profile. Here in the initial at the 0 point time, here there is no concentration of the drug in the body will be present, in that blood will not be there. And here once some time is proceeding, as long as the time is proceeds for the maximum time, what will happen? Initially there is a concentration of the drug in the body will be slowly increases. At that particular time, when the maximum point that Cmax will be arrives here, there is it will be starts that particular declining in the plasma concentration time profile. Once it attains that equilibrium, distribution equilibrium, it will be proceeded by that elimination step, which is said to be that particular metabolism and as well as the excretion. Simply you can say that once the drug is administered through the oral route, that whole drug will be experienced all the pharmacokinetic parameters, four pharmacokinetic parameters, which is the absorption, distribution, metabolism and the excretion. Depending upon the route of administration, that plasma concentration time profile will be varied. And here these are the two important whole plasma concentration time profile can be characterized depending upon the parameters that can be explained. In order to evaluate that plasma concentration time profile or the two parameters. First one is the pharmacokinetic parameters and second one is the pharmacodynamic parameter. This is the list of the pharmacokinetic and as well as the pharmacodynamic parameters. Here what are the pharmacokinetic parameters? Or the peak plasma concentration, which is commonly said to be the Cmax, time peak plasma concentration, which is said to be the Tmax, and AUC, area under curve. And pharmacodynamic parameters, which will be or comes under that minimum effective concentration, maximum safe concentration, onset of time, onset of action, duration of action, intensity of action, therapeutic index, therapeutic range, and as well as the termination of action. This is the plasma concentration ideal graph for the plasma concentration time profile after the drug which is administered orally. Once the drug is administered orally, so far that obtained at plasma concentration time profile after the plotting by taking concentration on the y-axis on the time on the x-axis. This is the ideal plasma concentration time profile, which will shows all pharmacokinetic and as well as the pharmacodynamic parameters. You can say here, you can see here that starting point is the drug administration will be takes place. Here what are the parameters I have included here? Peak plasma concentration, Tmax and the Cmax. You can see here this is the Cmax, which is the peak plasma concentration of the drug. Here next one is the Tmax, which is the time of peak plasma concentration time curve will be there. The curve which is covered under this whole plasma concentration time profile will be considered as that particular area under the curve. The curve which will be covered, but whole the area will becomes under the area under the curve. All these are three comes under the pharmacokinetic parameters, which are the Cmax, Tmax and the AUC. And next one is the parameter that covers under the concentration time profile is the pharmacodynamic parameter. If you see, all these are the very important pharmacodynamic parameters or minimum effective concentration and maximum safe concentration, that is MEC and as well as the MSC. And apart from that, onset of action, onset of time, intensity of action and as well as that particular duration of action and therapeutic range, all these will be very important for pharmacodynamic parameters. Here if you see at the Cmax, rate of absorption is equal to that rate of elimination rate. At that particular Cmax, the absorption phase, whatever the drug is that absorbed into the body, the same amount of the drug will be eliminated away from the body. At the Cmax, that is the significance you need to consider at the Cmax. And at the absorption phase, if you see that portion of the curve onto the left side of that peak, what will happen? The rate of absorption will be more and more compared to the rate of elimination. If you see there is no elimination will be there, this is the absorption phase. Here this is the lag period, here this is the absorption phase. If you see this graph, rate of absorption will be more and more compared to that there is no elimination. But at the elimination phase, if you see right hand side of that particular Cmax, rate of elimination will be always greater than the rate of absorption. More and more drug drug will be eliminated away from the body onto the right hand side, whereas coming to that, if you see onto the left hand side, more and more drug will be enters into the systemic circulation. And third point you need to consider here is at the Cmax, rate of absorption is equal to the rate of elimination. And now coming to the individual explanation of the each and every pharmacokinetic parameter. First what are the three parameters, pharmacokinetic parameters? Peak plasma concentration, time of peak concentration, and AUC, which is considered as area under the curve. What is the peak plasma concentration? It is also called as, commonly called as peak height, maximum drug concentration, or peak plasma concentration. Where what is the peak plasma concentration is nothing but the point at which maximum concentration has to be shown in that whole plasma concentration time profile. Time profile is said to be the Cmax. This is the point at which the Cmax can be represented. Where what is the significance here you need to consider means the maximum amount of the drug concentration will be attained at say Cmax. That's why it is also called as peak height or the maximum drug concentration. At the Cmax, as I discussed earlier, rate of absorption is equal to the rate of administration. And for what purpose this parameter will be important means it will be completely in order to determine that amount of the drug that enters into the maximum circulation, maximum amount of the drug that enters into the systemic circulation can be determined by using this peak plasma concentration. And this peak plasma concentration, that means how much the maximum, what is the concentration that attained at that particular time will be. They mainly depends upon the three parameters, which are the dose administered. What is the dose? If you are administering 500 mg, peak will be height. If you are administering the lower dose, the peak will be less. That peak will be depending upon that dose administered. Second one is the rate of absorption. If you that particular drug shows that greater absorption, it indicates that more and more amount of the drug reaches in the systemic circulation, it will shows that particular maximum height. And another thing is the parameter that which that peak plasma concentration depend is that particular rate of elimination. And here what are the units means? Common concentration units only mg per ml, or otherwise the microgram per ml. Majority of cases that microgram per ml will be considered. These are the units. And now coming to second one is the peak time of peak concentration. The name itself, it is explaining that time of peak concentration. Already in the earlier you have discussed about the pharmacokinetic parameter, which is a peak plasma concentration. The name itself, it is explaining the time of peak concentration, nothing but the time that required to reach that peak plasma concentration Cmax is said to be that Tmax, and it is the important parameter for estimating that rate of absorption. Here it is a main important parameter to determine estimating that amount of the drug that reaches the circulation. This is the parameter which will be estimating same thing only with respect to the rate of absorption. And onset of action and as well as onset of time will be depends upon the Tmax only. And the units of this Tmax are the hours. Time units only, which are the hours. And third parameter, which is that particular area under the curve. Area under curve is nothing but here the total integrated area that covers under the plasma concentration time profile is said to be that particular area under the curve. Here what will be gives that idea means each will be expressed in the extent of the drug absorption after the administration. Commonly what are the units of this area under curve? Mu g per ml dot hour. And here this is the important parameter in order to estimate that extent of that absorption. There in that plasma concentration that peak plasma concentration and as well as the Tmax, which is the time of the peak concentration, will be useful to determine the rate of absorption. Whereas here AUC is mainly useful to determine the extent of the absorption. And here next one is the pharmacodynamic parameters. First one is the minimum effective concentration. What is the minimum effective concentration, which is also said to be the MEC or MIC? Nothing but the minimum concentration of the drug that required to show the therapeutic action. You are administering a 500 mg of the drug. The peak plasma concentration shows at the 200 mg or 300 mg, somewhere it will be shows. And here what is the minimum concentration? At out of that 500 mg, even that point, that therapeutic response can be obtained even at 100 mg also. That is the minimum concentration that required to show that therapeutic response. That concentration is considered to have that minimum effective concentration. With that minimum concentration, which will be shows that which is responsible to show the therapeutic response, is said to be the minimum effective concentration. And here beyond that that particular minimum effective concentration, actual therapeutic action will be starts. And here also referred as minimum inhibitory concentration also is commonly it is used as the minimum effective concentration only. But in case of the drugs such as the antibiotics, this minimum effective concentration is considered as the minimum inhibitory concentration. Why it is said to be the minimum inhibitory concentration means that is the minimum concentration that required to get rid of, or in order to kill or inhibit that bacteria. In order to inhibit that bacteria, that minimum concentration is enough. That's why in case of the drugs such as antibiotic, that minimum effective concentration is considered as the minimum inhibitory concentration. And the drug below that MEC is said to be the therapeutic action. Unless otherwise the drug reaches that minimum, the drug shows that minimum concentration, the drug does not shows any therapeutic action. That's why below this MEC, the level is said to be the therapeutic action. If you see, this is the minimum concentration. If you are taking that 2 microgram per ml, 3 microgram per ml, 4 microgram per ml. If you are considering here 4 microgram per ml, that minimum 4 microgram per ml is responsible to start that therapeutic action. Whereas that 2 and 3 are considered as, these concentrations are considered as the subtherapeutic concentration, below which it does not shows any therapeutic action. If you are considering here the 4 microgram per ml, coming to the 1, 2, 3 will be considered as the subtherapeutic level concentration. It will not be shows any therapeutic action. And next one is the maximum safe concentration. It will that maximum concentration, which is also called as MTC, which is the that minimum toxic concentration. Beyond this maximum safe concentration or minimum toxic concentration, the drug that concentration of the drug that present in the plasma will be responsible to precipitate the side effects or otherwise the adverse effects or otherwise the toxic effect. If you see in the graph, this is the maximum safe concentration, which is also called as minimum toxic concentration, beyond which is considered as that concentration is capable to produce many precipitate many toxic effects and as well as that side effect. That's why that level above that MEC level is considered at the toxic level. Here it is the 4 mg, which is considered at that particular minimum effective concentration. Beyond, if you are saying 4, 5, 6, 7, let it be take here 80 microgram per ml or something point will be there. Beyond that microgram 80 microgram per ml, the drug will be shows that particular toxic effect will be takes place. Ideally, here regarding that Cmax point here, ideally the Cmax should be above the MSC and below the MSC. That's why you are saying. Why means here the Cmax is responsible to show that particular maximum pharmacological action. If the Cmax is above that minimum toxic concentration or the maximum safe concentration, it will give that particular toxic effects or the side effect. If it is below the MEC, it does not give any therapeutic action. That's why for the ideal drug therapy, the Cmax is considered to have below that the concentration should be above the MEC and below the MSC. In between this range should be that Cmax should be noted. And here next point is the onset of action. What is the onset of action is that particular starting point of the point at which that exceeds that just point exceeds that MEC, which is the way that pharmacological response is started, is called as onset of action. If you see, this is the onset of action. This is the MEC level. Above that, just proceeding to exceeding that MEC level, that onset of action point will be represented. What is the onset of action? Is nothing but here the point at which the starting of the pharmacological response is started. Here minimum effective concentration, the minimum concentration which is responsible to give the pharmacological response. Below it does not give any therapeutic action, but just exceeding that MEC, the point is considered is known as the onset of action. Here what is the onset of action? Is the starting point, the point at which that pharmacological action is started is said to be the onset of action. And next parameter is onset of time. Onset of time is nothing but the time to reach that onset of action is said to be the onset of time. If you see in the graph, this point is the onset of action, this point is the onset of time. The same thing only. What the onset of time is? It's the time required to a drug to start the producing the pharmacological response. Nothing but the time to get that onset of action is said to be onset of time. Coming to that, onset of action is completely depends upon the dose administered, rate of drug release from its dosage form, rate of absorption, and as well as the rate of elimination of the drug. And here onset of time is mainly corresponds to the time for the plasma concentration to reach the minimum effective concentration after the drug administration. Faster that if that particular drug is fastly reaches that MEC level, faster the onset of time, and thereby onset of action will be faster. That's why that onset of time, you can say, it directly corresponds to the time for the plasma concentration to reach that minimum effective concentration of the drug. And next one is the duration of the action. What is the duration of the action? Means the time period for the plasma concentration time profile to remain back, or otherwise simple words you can say the drug, that the time required for the drug to spend above the MEC level is said to be the duration of the action. That means, and it also defined a difference between the onset of time for the drugs and drop back to the MEC level is said to be the duration of action. Nothing but from here to here it is said to be that particular duration of action. In simple word, the time difference between that onset of action point to the MEC point. This is the MEC point. This is the onset of the action. That the time spent by the drug above the MEC level is considered that particular onset of considered as the duration of action. And intensity of the action in the next point, which is it is the maximum pharmacological response that produced by initially Cmax. You said that maximum plasma concentration that shown by that particular plasma concentration time profile. Intensity of action is, and the same thing only, the maximum pharmacological action that produced by the peak plasma concentration of the drug, which is also called as peak response curve. This is the intensity of the action. The drug is capable to show this much of the pharmacological response. This if you are plotting again that dose response curve, time response curve, this much of the response will be shown by that particular drug. The maximum pharmacological response produced by the peak plasma concentration of the drug is said to be the intensity of action, which is also called as peak response. And the next parameter is therapeutic range. Here in the first two pharmacodynamic parameters, two are there. First one is the minimum effective concentration, second one is the maximum safe concentration, which is called as minimum toxic concentration also, and whereas MEC is also called as minimum inhibitory concentration. Here what is the therapeutic range means? Nothing but the concentration of the drug between minimum effective concentration and maximum safe concentration is known as the therapeutic range. Nothing but the range between, whatever the range that lies between the MEC and MSC is said to be the therapeutic range. And next one is the therapeutic index. What is the therapeutic index? Is the ratio of the MSC to that of the MEC is said to be the therapeutic range. If you take that MSC is considered as 80 microgram per ml. If that MEC is considered as 4 microgram per ml, that 80 divided by 4, that 220 will be the therapeutic index of that particular drug, and it is also defined as ratio of dose required to produce a toxic effect or the lethal effect of the dose required to produce the therapeutic effect. Already we discussed that MEC is the dose that will be responsible beyond which will be shows the toxic effect. MEC is minimum dose that required to produce a therapeutic effect. That's why in the other words you can say it is a ratio of ratio of dose required to produce the toxic or the lethal effects, and to that of the dose required to produce the therapeutic effect. And what is the termination of action? The time period after which the drug levels of the drug decline below the MEC when there is no therapeutic action is said to be that particular termination of the action. The area, this area, that whatever the below that subtherapeutic level completely, this area here you can represent a particular termination of action. That means there is no concentration of the drug will be there in our body which is responsible to give that clinical response. Is that point is said to be the particular termination of the action where there is no clinical response can be shown. And all these are up to now I have discussed about the different parameters that covers under the plasma concentration time profile. This is one of the graphs, simply you can say, which can be explains that all the pharmacokinetic parameters and as well as two important pharmacodynamic parameters. Already I said that here the Cmax for the ideal drug therapy, it should be above MEC and should be below MSC, maximum safe concentration and minimum toxic concentration, whereas this is the Cmax, this is the Tmax, this is MEC, and as well as this is MSC, where the shaded portion wherever that shows under the plasma concentration time profile is considered as AUC. In this graph all the parameters I have mentioned, whereas particularly AUC I have not mentioned. Here if you see whatever the shaded portion you can see here in that portion is said to be the AUC. The total integrated area that covers under that plasma concentration time profile is considered as that particular AUC. And here the different plasma concentration time profiles only. If that particular Cmax will be high, say that Tmax will be low, what are the different parameters here? This is the this is the MSC, and this is the MEC. This is the therapeutic range, which is also called a therapeutic response, which is shown there. By seeing this graph, you can find all the graphs or fails to give that optimum therapeutic activity. If you see this green color curve, what will happen? It is the curve is above the MSC, which is the maximum safe concentration. That means the drug will be precipitate some toxic effects. Here what will happen, if you see the C and B graph, the B is capable to maintain the longer duration of action. That means longer period that spent by the drug in the body will be more and more, but it fails to give the therapeutic action. Why? There is no it will not be crosses that minimum effective concentration. Without showing any minimum effective concentration, there is no therapeutic action. That means that B curve shows maximum time is spent by the drug in the body will be more, but it does not process that MEC. It will be subtherapeutic level only. Whereas the C graph, it remains a very shorter period of that time, but it also fails to give the therapeutic action since it is below that particular MEC level only. If that, even though shorter period, if that particular blue curve is shows above the MEC, it is possible to give that therapeutic action. Here what will happen, both are the graphs, what does it indicates here? These two graphs are subtherapeutic level which fails to give that therapeutic action. Here A, it will give the therapeutic action, but it as usually it also proceeds with the precipitation of the side effects or the toxic effect. But what is the ideal drug therapy? It shows the maximum therapeutic effect with the minimum side effect. That means all the graphs fails to give the optimal drug therapy. Same thing only, whatever that graph with there I have mentioned here in that Cmax is above the MEC level. In order to give the full clarity, all the pharmacodynamic parameters I have mentioned here. This graphical representation explains that ideal graph. Here it does not, no graph shows that ideal drug therapy. Here, this is the ideal plasma concentration time profile, which shows that 100% therapeutic action. Here, if you see, Cmax is below the MSC, minimum safe concentration, and above the MEC. The duration of action is also optimum time is there, and absorption period also good, and elimination period of the also good. If you say this is the onset of action, onset of time, everything will be under control. And here concentration versus time graph. Apart from the concentration, the time that spent by the drug is also very important. Here dark blue color indicate the Tmax at 1 hour, whereas that particular pink color graph shows the Tmax at 2 hours, whereas that light blue color will be shows the Tmax at the 4 hours. How can you indicate the Tmax with respect to that particular time interval is shown in that? Only the here representation is the Tmax. This is the Tmax for 1 hour. This is the Tmax at the 2 hour. That means Cmax can be shown at the 0.8 microgram per ml. Here if you see at the 2 hour, the Cmax can be shown at 0.7 or somewhere. Whereas here if you see that Tmax will be 4 hours, whereas Cmax is 0.44 microgram per ml. Here the representation is concentration versus time graph with respect to the Tmax representation. And here that same thing only, plasma concentration time profile with respect to the different modes of administration. Depending upon that mode of administration, plasma concentration time profile may also be varies. That if you see, this is the pink color graph representation shows that plasma concentration time profile with respect to the IV administration. When the drug is administered through the IV route, what will happen? As it eliminates that absorption step, entire drug will be enters into the systemic circulation. There is no lag period. As soon as the drug will be administered, instantaneously and simultaneously the whole drug will be enters into the systemic circulation. That's why the graph shows in the starting itself, without any lag period, the whole drug will be enters into the systemic circulation, and followed by that whole characteristics of the drug, the experience of the drug can be explained by the two parameters only, that is two disposition process only, distribution and as well as the elimination. This is the pink color graph indicates that plasma concentration time profile at the drug levels with respect to the IV, whereas that green graph shows intramuscular route, whereas subcutaneous blue color, sky blue color graph shows that subcutaneous route, whereas that violet color graph that oral route. Whenever the drug is administered through the oral route, here what will happen? The disintegration, dissolution, all things will be somewhat eliminated. That's why here the drug spent by the drug that administered the intramuscular route and subcutaneous route will be less. But the drug will be, when administered to the oral route, it has to be passed through the almost all the critical steps, that means disintegration, dissolution, permeation, all it has to be processed. That cell membrane, everything has to be crossed. That's why the drug spent by the time spent by the drug in the body will be more. This is the summary of the plasma concentration time profiles by the various routes of the administration. Thank you.